Welcome, everybody. We are talking about something that affects, I'm pretty sure, every single pregnant and or postpartum person today. We're talking about lower back pain. This is such a common issue that comes up for people in pregnancy and or in the postpartum period as our bodies are adjusting to pregnancy. Our center of gravity is shifting and everything is kind of stretching out. We often experience back pain. So Krysta from Care and Physiotherapy is joining me today to talk about what to keep in a close eye for, what we can do about back pain, and how we can kind of help manage the pain and prevent it from becoming chronic pain. So make sure to listen to this episode if you are pregnant or postpartum, because this is huge in that population. And make sure to send this to a friend that's pregnant or postpartum as well.
Welcome to the She Found Motherhood podcast. We are doctors Sarah and Alicia, maternity physicians and moms who have been through it all. We want to empower you with knowledge so you can have the best pregnancy, birth, and postpartum experience you can.
She Found Health and She Found Motherhood is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This information does not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. The views expressed by She Found Health and She Found Motherhood and our guests are not representative of any of the institutions with which we are affiliated. Some of our podcast episodes are sponsored so that we can keep getting great info out there to you, our listeners. We only partner with companies that we truly believe in. Some of our links and suggestions may be affiliates, and we would appreciate you using them to help fund this important work. Now let's get to it.
Krysta, thank you for joining us. We are talking about something that I think probably affects almost every pregnancy out there and postpartum as well. Back pain. So we're going to talk a little bit about lower back pain specifically because this is a huge topic and there's so many reasons around having back pain at the best of times, but especially in pregnancy and the early postpartum period, that we really want to try and keep this as focused as possible. So we're going to chat a little bit about back pain. What are some of the common reasons we have back pain in pregnancy and postpartum? What other things do we need to be aware of that it also could be, when to seek help, and what kinds of things you as a physiotherapist can offer to people who are suffering from back pain. So why don't we start off by you just telling us a little bit about yourself and how you got into this line of work, and then we'll get into back pain in pregnancy.
Hi, Alicia. Thank you so much for having me. It's always a pleasure to have a talk about these topics with you. My name's Krysta Norwick. I am a physiotherapist and I have extra training in pelvic health physiotherapy and pregnancy and postpartum physiotherapy. I love helping people during this time and I see clients virtually. I own an online physiotherapy clinic called Care and Physiotherapy, and I'm really passionate about getting education out there so that people know more about what they might expect and what they can do if they experience any symptoms. So I am so happy we're talking on the podcast.
Thank you for being part of an amazing team that cares for our pregnant and postpartum population, because the more and more Sarah and I do this, the more and more realize that this is a team sport, this whole pregnancy, postpartum, both from the care provider point of view, but also from the patient or client point of view. None of us can do this alone. So wonderful to chat with this. Okay, so why don't we dive in? Back pain in pregnancy.
Yeah, so lower back pain is really common, like you said, during pregnancy. And sometimes it's a little bit hard to know if you're experiencing lower back pain or pelvic pain because your lower back ends and your pelvis starts. So sometimes it'll feel like lower back pain, but maybe it's more actually your pelvis or your pelvic girdle that you're experiencing pain in. And it can happen at any stage during pregnancy. So it can happen really early on or not until way later. And interestingly, when I examined the most recent research study on this, they didn't find that the gestational age of the baby impacted how severe the lower back pain was. So it can happen at different severities at different stages of pregnancy. And it is something that is very treatable. So if you're experiencing it, reaching out to your care provider and a physiotherapist can definitely help with mechanical back pain. So that's back pain that is due to maybe movement patterns, muscular imbalances, posture changes, which of course happen during pregnancy, and muscular changes, which also happen during pregnancy. So your core muscles are lengthening, your pelvic floor muscles are changing. Those are the muscles that are right in the hole of your pelvis, and they're really important for stability of your pelvis and holding up your body weight. As your body weight changes during pregnancy, they change, and sometimes they are contributing to the back pain as well. So there's a big picture to think about: core muscles, back muscles, pelvic floor muscles, and how all of your joints are interacting. You don't need to think about all those joints, but the physiotherapist can think about them and let you know exactly what's going on with you.
Yeah, exactly. And we've chatted a little bit about this before, but certainly in those times of our lives that we have some shifts in our hormonal balances or imbalances, however you want to call it, that's normal stuff, right? Like these are normal hormonal shifts. These are not abnormal hormonal shifts, but they do impact our musculoskeletal system. So our muscles, our tendons, our ligaments, and our bony structures. And as a result, we can have changes in how our body moves and shifts and compensates for each other. And we can have discomfort. So teenage years, pregnancy, postpartum, and around that menopausal time, it's super common for women to have musculoskeletal issues. And it's not abnormal, but it's not always fun. And so seeking help and getting some support around that is really important. So I'm not sure how you want to approach this in terms of different causes of back pain, or if we want to chat about symptoms people might experience.
Yeah, let's chat about symptoms and especially how they might differ pregnancy versus postpartum. In pregnancy, often what happens is you get a slow onset of back pain. Like you just start to notice your back, it's a little bit more sore, a little bit more sore. And it might be with specific movements, like maybe leaning forward, unloading the dishwasher, vacuuming, or lifting things. Sometimes it can come on quickly as well. And you might feel like really specific pain in your lower back or pelvic area. So it might feel dull, achy, like a muscle ache. It might feel more sharp or intense. And you may also feel neurological sensation. So that's where you might feel some numbness or tingling moving down into your glute muscle area or down your leg all the way to your foot. That is a little bit more rare, but it can still happen. And in the postpartum period, the symptoms might feel somewhat similar, but sometimes if you've had back pain during pregnancy, it's gone immediately once baby comes out. Sometimes it lingers or sometimes it changes because your body has just gone through a big change. So you may still feel pain in the same area. It might feel like it's moved around a little bit. You might feel some neurological symptoms or they may have gone away. And sometimes it can come on quicker postpartum. I've noticed that it is more likely that people will notice it come on faster and they'll be like, whoa, where did this come from? And often it's because there are just so many changes that your body is going through, plus all of the lifestyle changes of caring for baby, that your body is just having a hard time adapting all at once. And sometimes you may notice that it impacts your ability to move. So if it's so painful, sometimes you might feel like you're frozen or it's really weak or it's really hard to move. Sometimes you may even feel like there's a bit of leg weaknesses. And those symptoms can be really quite scary when they happen. But don't worry, that's what we're here for. Physiotherapy is here to help you. Your primary care providers are there to help you. We can help you get on top of the symptoms and be able to function. So move your body the way that you need to again. I think it would be good to talk about symptoms that would be really important for you to go directly to your primary care provider for, and symptoms that are really exactly what physiotherapists can help you with. So what I've talked about, that sort of aching back pain, sometimes some sharp shooting pain, that's usually something that's really physiotherapy specific. But I'm wondering from your perspective, Alicia, what other types of pains might be a really good sign that they should come see you or their primary care provider?
Yeah, that's awesome. Thank you. So I think big ones, we want to make sure that you're not in preterm labor. So if you're getting closer to term, after 25, 26 weeks, and you're having intermittent but consistent back pain, lower back pain, every 10 to 15 minutes, you're having a minute or two of back pain, those types of things can actually be a sign of preterm labor. So if that's going on for more than an hour or two and you've rested and it's not going away and it's consistent, and or your stomach is getting harder with, those are things that we actually really want to hear about. So that's a call to your primary care provider, your maternity provider. For sure. Another thing that's really important is bowel and bladder function. So if you are having fecal incontinence, so if you're pooing your pants, if you can't hold in your bowel movements, or if you're unable to urinate. Most people pee more than they want in pregnancy, have some leakage. That's not what we're talking about. That's also an issue you can talk about, especially with your pelvic physiotherapist. Not abnormal, annoying, but if you're unable to urinate and you have to pee, or if you're unable to hold your bowel movements in, those are big signs that we need to hear about urgently if you're having associated with back pain or not back pain. Either way, we need to hear about that. And the other thing is if you're having more upper back pain, or kind of pain that's starting in your upper back and moving down into your sides, and it's quite significant, or you're having fevers or chills associated with it, we worry about that being a kidney issue, so kidney pain or kidney infection or a kidney stone, which is unfortunately not super uncommon in pregnancy. So those are things that we want to hear about as well. So the kidneys sit under the lower ribs at the back. So if you're having aching there, if you're having fevers, if you're having pain with urination, or if you're having coming and going pain again, that you can't get comfortable with, that's starting up there and slowly moving its way down, that's when we worry about a kidney stone, and we can certainly help you with that. So those are the big things that I just want people to be aware of when we're talking about back pain. Now, most people who have back pain, it's none of those things, but certainly if you're experiencing any of those symptoms, reach out sooner rather than later. Yeah, and so I think that's the big stuff. I know when I was pregnant, not with my first, I was fine. With my second, my SI joint. So we're talking about our pelvis and our spine, right? So at the end of our spine, we have our pelvis attaches to our spine through the sacroiliac joints and through the SI joint. And it's not a super mobile joint mostly, but nearing the end of our pregnancy, we release this hormone called relaxin, which allows everything to move more so you can push a baby through your pelvis. And my SI joint, my right, we call it my Achilles heel in my family, has since then has been a challenge for me. And if I'm not using my proper techniques when I'm doing weights, or for instance, last week when I was shoveling the snow, I quote unquote threw my back out. And so I think this is where physiotherapy is so vitally important in terms of helping people understand the mechanics of their body and how to really use correct form and strengthen up areas that support your lower back and your pelvis. So let's chat a little bit about that in terms of what we can do around those pieces of the puzzle.
Yes, absolutely. It's such a big factor. So during pregnancy, I mentioned your body is changing quite a bit. So as your body changes, your physiotherapist can help support your body through those changes and help you learn how to use your muscles now that your posture is a little bit different or your ligaments are becoming more lax, just like you're talking about. And sometimes that means we need to optimize the function of the muscles. So sometimes we need to actually pace our muscles a little bit more. So give all the muscles a bit of a better rest when you're not up on your feet doing things so that they can have a bit more strength and endurance available to them when you are doing something. So you can think most people know that your core muscles are important for stabilizing your abdomen and supporting your lower back. So if your core is getting weaker or more tired more easily just because your body is changing, then giving it a good rest and then using it can be so helpful for just ensuring that your muscles have that rest they need and then the energy they need when you want to use them. The other big thing that can help is strengthening of certain muscles. I've mentioned this before in previous podcasts, but working with a pelvic physiotherapist from the start of your pregnancy through your pregnancy is so helpful because we can give you things that you can start working on right away before a lot of these changes are happening where your posture is changing or your abs are getting stretched. You start to work on these things prior. That can be really helpful. And learning how to use your pelvic floor muscles can be super helpful. This study I'm referencing here is not specifically done for pregnancy and postpartum. However, it was done on all people with lower back pain. And they found that there was a significant percentage of people who also had pelvic floor muscle dysfunction, or the muscles just weren't quite working as well as they could. And that can contribute to lower back pain and vice versa. So really learning how to use your pelvic floor muscles and your core muscles to the best of your ability, and strengthening if that is something that makes sense for you. And that's a little bit hard to tell. Not every strength exercise is going to be appropriate for every person. So that's where physiotherapy really comes in to teach you exactly what is the most appropriate exercise for you at that time and at that stage that you're in. The other really interesting thing that we know about pregnancy specifically is that introducing novel movements is really helpful for lower back and pelvic pain. And what we mean by novel movements is basically moving in a different way than you do normally. So, one perfect example is walking backwards. So if normally you walk forwards, which most of us do, a few times a day, if you are walking in the bathroom or something like that, you can walk backwards. And that can actually be really helpful to calm your system. Won't get too technical here, but there's multiple different systems that can impact your experience of pain. And so if you are changing things up and giving them a new stimulus, like walking backwards or doing a movement in a slightly different way, that can help calm the systems down and your experience of pain can decrease dramatically. So that's something that physiotherapy can help with, is teaching you those novel movements and finding ones that work well for you. Because if I know 50 of them, maybe only 3 or 4 of them work well for you, and we can find those ones that work well. With lower back pain, it really should be a team approach. So, one of the big roles as a physiotherapist is coordinating with your team. So, maybe massage therapy, chiropractor care, your primary care provider. We want to work together to ensure that everyone's working together to help you with your lower back pain, if that is what's going to be most helpful for you. And then, of course, the other thing that a lot of people will talk about is actually wearing a belt or a band around your pelvis to help support your pelvis and your lower back. And just like we've talked about before with splints and braces, they can be really helpful for symptom management. Sometimes they're not helpful because they are uncomfortable to wear, but sometimes they can be helpful, especially if you're nearing the end of pregnancy and doesn't seem to matter what you do, you're not able to find relief from your pain. Adding a band around your pelvis can just give you a little bit of external support so that you can still do your activities of daily living that you need to do. And you can wear it when you're doing that. And then ideally, you only wear it when you absolutely need to. And then you would take it off when you can, so that you're not losing any muscle strength and you're able to just give your pelvis a rest from that. This, I would highly recommend that if you are going to wear a band, you do it in conjunction with talking with your care provider or your physiotherapist to ensure that it is the right option for you and that there's no contraindication. So there's no reason that you shouldn't be wearing it. Usually that's more common that people would wear it during pregnancy. Sometimes I've also prescribed it to people during the postpartum period, but it's more rare because usually with exercise and the fact that you're no longer pregnant, usually those symptoms will resolve quite quickly. But during pregnancy, of course, it's a little bit trickier. Oftentimes the symptoms will resolve as well during pregnancy, but it can be a little bit harder just because you're continuing to be more and more pregnant. And so getting on top of it with exercises and movements can be a little bit harder. It's like we get a few steps forward, but then the pregnancy progresses a little past that. And so it can be a little bit of a balance to find this symptom relief that you're looking for. That is an option that we can help you with it.
Yeah, that's
And
awesome.
then, of course, the other big one is education.
Yeah, and I think so you bring up a couple of good points. So I think one thing that is really hard to do, but is a really important thing to do, and it's around that education piece, I think, is understanding that back pain is not abnormal in most cases, and not focusing on it in the terms of using your mental energy, worrying about it and letting it bring you down from a psychological point of view. And so I say that because we know chronic pain can become an issue when we have prolonged pain, and our mental attitude towards it is a negative one. if I'm saying that properly. And so by understanding how your body is functioning, why things are happening, what you can do to modify it, that it will most likely improve, we can have a bit more of a positive attitude around the pain. So we understand why it's happening, because what we don't want to happen is our our psychological behavior is so powerful in how our body functions and how we move forward with things. And what we don't want to happen is to have these kind of negative receptors set up within our system that it prolongs the pain. And a big part of things are the education piece. Sometimes counseling can be really helpful if this is something that's really impacting your life and your psychological issues are coming up because of that. And it certainly can be, because it can be really frustrating. And the other thing is mindfulness can be
Absolutely.
really effective too, in just taking some space and really using your parasympathetic, so that's your relaxation system, to calm your nerves down. And so I think that's another important piece of the puzzle in terms of that team effect, is really looking at the psychological effects that this is having on you and how you can manage those pieces while you're doing all of the physical work as well. So that's another
Absolutely.
really important piece of the puzzle, because
And
we don't want this turning into a chronic pain situation. And there's certainly things that we can do to help prevent that.
absolutely. And I will also add in that it's something as simple as breathing. Learning to deep belly breathe can be so effective for pain management. Sometimes you might take 20 nice big deep breaths and your pain feels half as intense. It makes a really big difference to tap into that calm parasympathetic nervous system. And what's really interesting is that if we put more brain energy towards thinking about our pain, we'll actually create more neural pathways. So we'll actually create more pathways for ourselves to be able to feel pain. The converse is true. If we focus a bit less on the pain and we focus more on what movements we're able to do, or deep breathing, or mindfulness meditation, then we can actually decrease those pathways a little bit. And if something provides the same stimulus at the tissue, so say your joint is a little irritated, you might, for the same stimulus, you might actually feel less pain, which is really quite amazing to know that we have this ability to impact our experience of pain without even doing any sort of treatment to the tissue itself.
Yeah, and this plays into labor as well. So we're talking about back pain and pregnancy here, but like a big thing, and the reason Sarah and I are doing all of this work and that we put together our prenatal course is because the more going into something, the more feelings of control you have over the situation. And certainly in childbirth, the more understanding you have about what's going on with your body and the potential issues that might come up and how you might deal with them if they do come up, the more empowerment you have, the more feeling of control. And so the less scary it can be and the less traumatic it can be from a psychological point of view moving forward. And so the more quote unquote enjoyable, or the more you can focus on those really positive things, is so beneficial. And so that's why we put together the course we did, because a lot of the courses that our patients have access to currently are not necessarily as, they don't have the breadth of information in them. And so people don't really know what to expect going into, or something happens that they're not expecting. It's quite challenging for them in that time. And they then later on are more likely to have that kind of traumatic birth experience, which is not what we want for anybody.
Hey Sarah, do you know what I've never asked you? Did you take a prenatal course when you were pregnant?
We did. Even though I'm a maternity care provider, my husband and I thought it would be an important process for us to go through together.
That's so cute. It must have been so hard for you guys to coordinate your busy schedules though.
Oh, tell me about it. I was a medical resident at the time and he was working full-time. We really struggled to find a course that would fit our needs and ended up doing a semi-private course that still was challenging to schedule and quite expensive.
Wouldn't it have been nice for you guys to have access to an online course with evidence-based content that you could do from the comfort of your own home or on your own time at your own pace?
You're telling me if I had had access to something like our Pregnancy to Parenthood Prenatal Masterclass, it would have been a game changer.
And that's the big reason we put this course together, to provide parents with access to a reliable, comprehensive prenatal education from the comfort of their own homes and the ability to watch it and rewatch it when and where they choose.
Plus, it's got so much great information about preparing for the fourth trimester, which I'll admit, I felt really unprepared for. We focus so much on labor and birth when we're pregnant without understanding how challenging breastfeeding in the fourth trimester can be.
I hear ya. And that's why we put together such a comprehensive module all about what to expect for the 4th trimester and for your newborn.
If any of you listeners are pregnant and thinking about a prenatal course, I may be biased, but I would 100% recommend our online course. Head on over to www.shefoundhealth.ca/masterclass to check it out.
We promise you won't be disappointed or your money back.
I know pelvic physio also can be extremely helpful around preparing for delivery in terms of kind of techniques and relaxation and how to use your pelvic floor and how to relax your pelvic floor. And that's another thing I really wanted to just remind people about, is because I think everybody assumes, especially in that postpartum phase, that their pelvic floor is now weak and they need to strengthen it and that they need to do Kegels all the time. But this is not actually always the case. Some people's pelvic floor in pregnancy, postpartum, is actually tight or too revved up, and they actually need to learn to rest it, right? And to stretch it out. And so that's where having a discussion with your pelvic physio and talking about these things is so vital, because I think a lot of us do disservice to ourselves by making assumptions that, oh, I had a baby, my pelvic floor must be too loose, I have to do all these Kegels. But actually having a proper assessment and talking about your symptoms and figuring out, no, maybe you'd actually need to learn to stretch and loosen your pelvic floor out because it's too overexcited. And
Yes.
Yes.
Absolutely. And that having a hyperactive pelvic floor can actually feel like back pain, or sometimes it might even feel like menstrual cramp type pain. And signs that you might have tightness in your pelvic floor would be potentially urinary leakage, pain with intercourse once you get back to sexual activity, back pain, constipation. So it's absolutely a great idea to have someone help you determine what your pelvic floor muscles are doing and what you need to do in that postpartum phase. And that actually is a good segue into, I wanted to bring up that if you are experiencing sudden changes in bladder or bowel function and you go see your care provider and they're like, yeah, it doesn't really seem like there's anything going on medically, it could mean that your pelvic floor muscles aren't quite doing the function at the best to their ability. So if your pelvic floor muscles are dysfunctioning a little bit, you might get bladder leakage, you might get bowel leakage, or you might have retention. So that's when you have a hard time emptying your bladder or bowel. I absolutely advocate for checking with your primary care provider first to make sure there's nothing else going on. And if there's nothing else going on, we can help with the pelvic floor muscles. Even though there might be nothing going on medically, that doesn't mean that there isn't something that you might be able to do about it. And your pelvic physiotherapist can help with that. And sometimes that will be associated with back and pelvic pain, and sometimes it won't be. So they can go together or they could come separately.
Yeah, awesome. Is there anything else that you want to touch on before we do our wrap up?
The only other thing that I wanted to touch on was sleep. So a lot of times actually, the lower back pain really makes it difficult to sleep during pregnancy. Physiotherapists can help teach you how to position yourself for sleep, but really what we're trying to do is support your body as much as possible so you can really relax your body when lying in bed. During pregnancy, especially as you get closer to the end, when your ligaments are getting more lax in preparation for labor and delivery, your joints are going to have a little bit more movement than normal. And so trying to support your body in a position where your joints can be supported in a more neutral position can be really relieving. So a lot of people like to use pregnancy pillows. So you can use a pregnancy pillow or you can use multiple pillows around your body. But having a thick enough pillow in between your knees can really help. If you're lying on your side, pillow between your knees and supporting your legs and your lower legs can really help your pelvis stay in that non-twisted, nice neutral position. And depending on what stage you're at, you might even want a very small pillow supporting under your belly. And you may even want to tuck a pillow or two behind you to support your lower back and your upper back a little bit so that you can just really relax into the pillows more. And that can help with your symptoms at nighttime and during the day. So sometimes if you're sleeping twisted, you're actually going to feel more pain during the day because of it. And hopefully it helps you get more sleep. And this is another one of those factors that contributes to your experience of pain. So if you're getting better sleep, your experience of pain actually will improve, even if nothing else changes. So addressing your ability to sleep is a really great idea as well. And again, that's something that a physiotherapist can help coach you through. And that's why I love the virtual medium, because you can show your physiotherapist over the screen your bed setup and your pillows, and you can practice the position and try a few different things, because what I just described is a bit more of a generic, okay, this usually helps most people. But of course, we're all individuals. And so it doesn't help everyone in every situation. And so fine tuning how thick of a pillow to use or which types of pillows can really give you that relief that you need at nighttime.
Yeah, we called it my pillow fortress when I was pregnant. I had like
Yes.
7 pillows that I would put all around me and in all these various positions. And my husband was like relegated to the very edge of the bed. Anyways,
Yes.
yeah, that is such a great tip. Yes, thank you. I know always forget. Yes, pelvic physio can help with sleep. Amazing.
They can.
Wonderful. Okay, so what did we chat about? We chatted about lots today. So reasons why we can get back pain and or pelvic pain, which really they're all very interrelated during pregnancy. Some symptoms to keep an eye on. And if you are experiencing, please reach out urgently to your care provider. And we also chatted about some things that we can do in pregnancy to help with that, and the role of physiotherapy and the team can really help. We talked a little bit about our brain, our psychological component to pain, and how that's so important in how we kind of function and perceive the pain and potential for long-term impacts if we don't focus on that. And we chatted about the role of physiotherapy and sleep. There was one more thing that, the one thing I really wanted to remind everybody about is we know there is a lot of evidence that movement throughout pregnancy, i.e. exercise, doesn't have to be training for a marathon. It can be going for a walk or going for a swim, doing your yoga, is so helpful and decreases aches and pains through pregnancy. It also improves birth experience because we're fitter during our childbirth experience, and also improves our postpartum recovery. So I think just maintaining activity throughout pregnancy in a way that you can, and certainly your care provider and your pelvic physio can really help guide you if you're having struggles, is so important. And I just wanted to make sure that we really touched on that point as well. So Krysta, thank you so much. This is a big topic, I know, and we only touched the surface. Thank you for joining us. Where can people find you if they want you to see their sleep setup and help them with that? That's such a great idea. I never even thought of that. You guys are so smart. So smart.
Thank you so much for having me. So you can find me at our website, cairnphysiotherapy.ca. So that's CAIRN physiotherapy.ca. We're on Instagram as Cairn Physiotherapy and YouTube as Cairn Physiotherapy. So you can find us there. You can reach out to us if you have any questions at all, and you can book online for a virtual physiotherapy session if you want.
Amazing. And hey, all you listeners out there, if you know of somebody who is pregnant, send them this podcast, because this is such an important one, because back pain affects us all in pregnancy and postpartum. Doesn't matter who you are. It may not be much, but it'll still affect you. So make sure that you send this to all of your pregnant and postpartum friends out there to give them some extra access to good information. And we will link all of your info in the show notes, Krysta. Thanks so much for joining.
Thanks, Alicia. Bye.
Thanks for listening. Make sure to check out our website at www.shefoundhealth.ca and to sign up for our community for weekly bump blasts. Make sure to check us out on Instagram or Facebook at she.found.motherhood, and head on over to your favorite podcast app and leave a review and a 5-star rating. If you enjoyed this podcast, take a pic of yourself listening to it and share it on social. Make sure to tag us on it so we know to keep making them.